Did you know that unexplained itching in certain areas of your body could be a silent warning sign of cancer? Many people ignore occasional itches, but for older adults, especially those over 60, persistent itching in specific spots might be more than just dry skin or irritation. It could be your body sending an important signal you shouldn't ignore. In this video, we'll reveal 5 particular itchy areas that may indicate cancer, sometimes months before other symptoms appear. These aren't random itches. Doctors have observed these patterns repeatedly in patients later diagnosed with serious illnesses like lymphoma, pancreatic cancer, breast cancer, and skin cancer. Stay with me until the end. You won't just learn which body parts to watch. I'll explain why these areas itch, the cancers linked to them, and how to distinguish between harmless skin issues and something more serious. You'll gain the knowledge to ask the right questions, know when to see a doctor, and take action if you notice these signs. Remember, this isn't about causing panic, it's about paying attention. Early detection gives you the best chance of successful treatment. Sign 1. Persistent itching on the lower legs. If you're over 60 and experience an unrelenting itch on your lower legs, especially your shins and calves, with no rash, dryness, or new products causing it, don't just assume it's aging skin. This symptom has been quietly reported in people diagnosed with blood-related cancers, particularly lymphoma. This isn't an itch that comes and goes. It often worsens at night and doesn't improve with moisturizers. The reason: cancers like Hodgkin's lymphoma affect your immune system. The cancer cells release inflammatory chemicals that irritate nerves beneath the skin, causing a deep burning itch even when your skin looks normal. For example, George, 75, shared that his only symptom for 6 months was this stubborn leg itch. Initially, his doctor suspected eczema, but blood tests revealed lymphoma. His itch was the first warning sign, long before other symptoms appeared. If you have a persistent itch with no clear cause, no rash, no new soaps, no bug bites, especially if paired with fatigue, night sweats, or unexplained weight loss, it's time to talk to your doctor. Sign 2. Itching between the shoulder blades or upper back. A deep itch between the shoulder blades is often dismissed as poor posture, dry air, or an irritating tag in your shirt. But for older adults, persistent itching in this area can signal pancreatic cancer sometimes months before pain or digestive problems begin. Here's why. Pancreatic tumors can block bile ducts, causing bile salts to build up in your bloodstream. These salts irritate nerve endings, often felt in the upper back's dense nerve network. Linda, 70, described a phantom itch in her upper back that wouldn't go away. Blood tests showed elevated liver enzymes, and imaging revealed a small pancreatic tumor pressing on her bile duct. Her itch was the only symptom. If your back itch is focused, persistent, and unresponsive to lotions, and you notice dark urine, pale stools, or fatigue, get checked out. Sign 3. Itchy scalp without dandruff or flakes. Many seniors experience dry scalp. But if you have a persistent itch without visible flakes or redness that feels like tingling or burning, and it doesn't improve with anti-dandruff shampoos, it could be an early sign of the blood cancers like leukemia or even skin cancer on the scalp. Henry, 73, had a scalp itch every afternoon. After trying various shampoos and hats with no relief, blood tests revealed chronic lymphocytic leukemia. His scalp itch was the first warning. Because scalp problems can be subtle, it's helpful to ask a loved one or hairdresser to check your scalp regularly. If your itch won't go away and you feel unusually tired or bruised, see a doctor. Sign 4. Localized itching on the chest or breast persistent. Itching on or around the nipple or beneath the breast can be a sign of inflammatory breast cancer or tumors near the chest wall. Often, this itch appears before any lump forms. The skin may feel warm, tight, or slightly red, but sometimes there's no visible change, just a constant, unrelenting itch that doesn't respond to creams. Ruth, 69, ignored an odd breast itch, thinking it was caused by bras or detergents. When checked, her doctor found skin dimpling and a small but aggressive tumor. This sign is important for both women and men, though male breast cancer is rare. Persistent itching or thickened skin near the nipple deserves medical attention. Sometimes itching in this area may also be caused by swollen lymph nodes from lymphoma or other cancers nearby. If the area feels heavy, swollen or warm, don't delay seeing a doctor. Sign 5. Persistent itching in the anal or genital area. Itching in the anal or genital region is uncomfortable and often ignored, but chronic itching here, without clear causes like hygiene issues or infections, could be an early sign of cancers, such as anal, vulvar, or penile cancer. People often assume it's dry skin, friction, or irritation, but if it lasts for weeks or months, returns despite treatment, or feels more raw and burning, it needs medical evaluation. Eugene, 76, suffered from chronic anal itching, assuming hemorrhoids were the cause. A specialist eventually found a small early-stage tumor. For women, vulvar cancer is rare, but more common after 60. Persistent itching that worsens at night and doesn't respond to treatments should be checked. Because this area is highly sensitive and full of nerve endings, chronic itch can be an early signal of internal changes. Your body is always communicating. Sometimes it uses pain or fatigue, but often it starts with subtle signals, like persistent itching in specific spots. The 5 areas we covered, the lower legs, upper back, scalp, chest, and genital region, are common sites where serious health issues, including cancer, first send quiet warnings. For older adults, learning to listen to these signals can make the difference between early detection and silent progression. Don't live in fear. Live empowered. If any of these signs feel familiar, don't ignore them. Talk to your doctor, ask questions, and take control of your health. Thank you for watching. If you found this helpful, please comment below with which sign surprised you the most. Don't forget to like, subscribe, and share to help others stay informed.